First thing you should do is label your agar plate, and you'll always label them on the bottom side. So we're going to label that side of the agar plate rather than on the lid, and that's because lids can easily fall off, they can get mixed up, and so you want to label the side that's going to have the bacteria on it. Another reason that you want to label the bottom side is that they always get stored lid side down, so it's easy to see your labeling on the bottom side of the agar plate. They're stored bottom side down because when they're incubating it gets quite warm, and so water comes out of the agar and condenses on all the surfaces. Here's an example of another agar plate that's been incubating, and you can see, if I turn it over, there's condensation on the lid. Now the problem with that is if you tap it, you end up with condensation on the agar, and the problem with that is that it can run all of your bacteria together. That's only a problem if you're trying to isolate bacteria, individual colonies, from the surface of your plate. And of course we are trying to isolate individual colonies from the surface of our plate. Therefore we always store lid side down, and in fact you should get into the mode of storing these lid side down just on your bench. Always turn them over, and that way you can easily see what's on the plate. So what do you put on there? Well, your name, the date, and the contents that are in here. This is going to be a throat swab. And then you're ready to go. Next technique I'll show you is how to take a swab from someone's throat. It's an oropharyngeal swab. You're going to want to find these sterilised swabs and tongue depressors. Pull them out of the bag. They look like this. A little cotton tip on it. And because you're putting these down someone's throat, the urge to gag and cough can be quite dramatic, so you're going to want to wear glasses for eye protection and also gloves. Everybody's going to be sitting in the chair as the patient, so just remember the urge to gag and cough may be considerable. You need to relax. Okay, so open wide, depress tongue, and get a swab from around the back of the throat, around where the tonsils are. The aim of the streak plate technique, which I'll show you now, is to isolate individual colonies, so you can pick an individual colony and identify it using gram staining. Now you're going to find a lot of different bacteria in your throat, and at the next practical you're going to determine the gram status of one or two of those different bacteria. When you take a swab from your throat, you're going to have a lot of bacteria on that swab. So the aim with this technique is to do a series of streaks that each streak successfully dilutes the amount of bacteria. Remember, protect your plate by just lifting the lid up and keeping it over the plate. This way microorganisms from the air are limited in their ability to drop on there. What I do with your swab is to just get it in there and swab over about 1/4 of the plate. Now at this point you can discard this swab and your gloves, because you're about to start using Bunsen burners, so these things should go into the yellow biohazard bin. I'll just show you what that looks like. Please remember to keep the plate as protected as possible with your lid, but this is what it looks like. You should be able to see streaks along that edge of the plate. That's going to result in confluent growth. There are way too many bacteria there to pick individual colonies, so what we're going to do now is a series of streaks to dilute that confluent bacterial growth. Now you should use a Bunsen burner to sterilise the loop. Just go to the blue flame and make sure you get that nice and red hot. Kill any bacteria that are there. Back to the yellow flame. That loop is really quite warm, and any bacteria touched with it is going to die, so cool it down on the agar over on the edge somewhere. You might hear a hiss, and just cool it down sort of right near the edge. Now you get that loop and take one streak through the swab region, across and back and forth until you've done about a quarter. You burn the loop again, nice and red hot. You should turn this plate around and again cool down your loop on the edge. Cool. Drag your loop through the area that you've streaked before and back and forth. Back to the Bunsen burner. Red hot. Turn the plate around again. Cool your loop down at the edge and one streak through where you've streaked before and streak down the plate. Again, we'll burn the loop just to be sure we get rid of bacteria. Now, what does this look like? Well, please don't leave these without the lid, but you should be able to see streaks. So over here we started with the swab and we streaked out here and then we streaked in this direction and finally down here. And so that's a series of streaking dilutions, and we should be able to isolate individual bacterial colonies from this section once we've incubated the plate.